Ladies and gentlemen, welcome to the program, introducing HealthEZ's mobile app. For this webinar, attendees will be in a listen-only mode. If you need technical assistance, please submit your request under the Tech tab in the window in the top right-hand corner of your computer screen. If you wish to submit a question during the presentation, please use the Q&A window in the top right-hand corner of your computer screen. Presenters will do their best to answer your questions. However, due to time constraints, not all questions may be addressed during this webinar. The presentation will now be turned over to your host, Jean Lefebvre.
Thank you very much. Good morning and welcome. We're very excited for everyone to hear about our presentation on our app, which just launched, and we think it'll be the best in the industry. This is our 11th webinar in our 2021 Easy Webinar Series, very generously sponsored by Accurus Solutions and Nationwide Insurance. And if you haven't been able to attend all of our webinars, we've had some great presenters on various topics. You can visit and listen to those at HealthEZ under News and Resources and our video library. And so with that, it's my pleasure to introduce today's presenters. First, we have Josh Schreiner, our Chief of Staff, who has really led this project for quite a while. He probably feels like he gave birth, just like his wife gave birth to Lola, as he will tell you, and maybe Lola will make an appearance. And also Brianne Parent, who is our Vice President of Client Relations. And so with that, I will turn it over to you. Thanks.
Great, and thank you, Jeannie, for that introduction. We're so excited to be here today to give you an actual demonstration of our new mobile app. Jeannie is right. I do have a almost 15-month-old daughter, Lola, who was born right at the beginning of the pandemic, and that's approximately when we really started planning to create and launch an app. And we had a whole host of individuals, both internal and external, that helped to brainstorm, cultivate, and come up with ideas for the mobile app. And one of the internal employees who was arguably most critical to that process was Brianne Parent, and we'll have her give us a guided tour of the mobile app today so that you all can see what your members and employer clients are seeing with the mobile app. Brianne has been with the organization for over 6 years now, and has held various roles from client services to account management to vice president of client services. And when we were talking yesterday about how we're going to open this webinar, we were the first thing out of her mouth when we were trying to come up with what we were going to say for how we came up with the functionality of the app and how we were able to launch the app was blood, sweat, and I think there was a lot of internal staff that put in thousands of hours of user testing, of brainstorming ideas, of working with designers and technical components of the app to make sure that we were able to put together an app that we feel is arguably the best in the industry. And when we started this process, one of the comments or recommendations from our leadership team was to go and look at the apps for other companies in the industry, specifically other TPAs. And what we noticed very quickly was that most TPA app ratings were very low, like below 2 stars. And we wanted to make sure that when we came up with an app, that it was solving or helping our members to answer the questions that they had. And we'll have Brianne talk to you just a little bit from her background in customer service on what those items were. So from a call center perspective, or what I was thinking about when we were looking to launch an app is, what are we getting calls about? Well, for our consumer base, there's really 4 items that stand out far and away. Number one is they want to know what their benefits are. If they go to an office visit at their primary care, what's their copay? If they also want to know whether a provider is in their network. And as most of you, if you're a distributor of HealthEZ's products, know, we're highly customizable. So we work with over a dozen regional, local, and national provider networks. So we had to figure out a way to allow members within the mobile app to find a provider. And the challenge with that is obviously the fact that we don't contain any of the provider data. It's all housed with the network, whether it's Aetna, Cigna, Arizona Foundation, or any other regional or national network. So we knew we had to solve for that. The third thing that people often call about is they want to know the status of a bill, or as we like to call it in the industry, a claim. How did my claim pay? Did it process? And Brianna will talk to you a little bit more about Easy Pay and that great technology that we have that's included in the app and that we've been doing for over 20 years. And then lastly, and as we get into the app, you'll see that it's a focal point, is the insurance card. That's the number one thing. If you become a new member of HealthEZ, the first thing, your first touch point with our company is going to likely be after open enrollment when you get your insurance card. So making sure that consumers had an easy way to access that insurance card, request a new insurance card, or download a copy of their insurance card was going to be really critical to make sure that the app had the usability that they were looking for. So I've talked a lot. I want to see if Brianne has anything to add to that, but that's how we got to the point of designing the 4 main pillars of the app, which are my account, my plan, find a provider, and then the home screen that allows you to see your deductibles and out-of-pockets.
Yeah, absolutely. I think that you've covered the highlights, and I'll walk through all of the details in just a minute.
Great. So now let's see if technology can work. I am going to share my screen here. And just as a disclaimer, this is dummy data. And if the image is not entirely crisp, I promise you it is entirely crisp on my phone right now. Can you see the app, Brianne?
Yep, we're good to go. Alrighty, well, thank you again for joining. I'm really excited to walk you through this demo today. As Josh mentioned, there's been a lot of work, and he said 15 months. I think it's up in almost nearly the whole 6 years that I've been at HealthEZ that we've been talking about and working on the launch of this app to ensure that we're producing a product that works for our members and is useful. So our primary focus was to make sure it's an easy experience for all of our plan members. And this starts upon login. And as Josh mentioned, it's categorized into 4 different sections, one being the home page, which is what we're demoing now. And then we'll walk through my plan, find care, and the account. Each page has specific information to make accessing care or using your benefits easy. But on the home page, the quick action links to pay medical bills through Easy Pay, pull up a copy of the ID card, find a provider, and review statements. You'll see these integrated throughout the other sections as well, but the purpose of the quick actions was to address the top questions that we receive as quickly as possible once a member's in the app. So like Josh said, people are calling us for a copy of the ID card because they find themselves at the doctor's office without their hard copy in their wallet. So what can we do to make those actions as quick as possible? And then down below, we have a summary that demonstrates where the member is at in meeting their deductible and out-of-pocket for the year. And we made it super easy to toggle back and forth to show both individual or family amounts met as applicable. At the top of the home screen of Future, we're excited to continue to enhance our notifications. We're currently able to push notifications when a bill is ready to be reviewed or paid through EasyPay, and then once a monthly statement is posted to the member account, which we'll talk about in just a bit. These have historically been just emails, so another way of the mobile app, we're excited to give members the option to replace another message in their inbox with the push notification of their preference as they'd like. And then another feature that we're super excited about is with this release is chat. This is exclusively available to members through the mobile app right now, and we're really pleased to offer another communication method where members can get answers to quick questions really simply. You click right into the chat and can talk to one of our customer service representatives who's here in Minnesota in our office. And again, it's to address those quick questions like where can I go to the doctor if I need help or something like that. Through the same click, members can connect or call their custom phone number or send an email to either customer service, the helpline, or case management. So again, you'll see this kind of repeated throughout all of the main screens, but we wanted to keep that contact us option as a primary focus because we know typically when members are using their health plan, it's not that they're super happy and not having any issues. We wanted to make it easy to get connected with someone if they have questions as they're reviewing this information. Switching over to the My Plan section, this section has all of the relevant plan information for a member to review regarding their plan. And again, as you'll see at the top, the chat Contact Us bubble stays in the upper right-hand corner. The top section of this page shows the subscriber ID and the effective date, and also links right to the ID card. On this ID card page, you can flip back and forth to the front and the back of the card. So if someone's at the doctor's office, it's very easy to show that information. And then down below, they can request that an additional copy is mailed to them, emailed, whether that's to them or their doctor's office, or download a PDF copy. Back to the My Plan page, the Bills section gives a summary of what's currently pending. So when a member clicks in, they can see what bills were recently processed and pay their responsibility, whether that's a copay amount, deductible, or coinsurance, right through our payment service, EasyPay. And just a brief reminder on how EasyPay works. Each time a medical bill is sent to us for processing, we adjudicate it through the system and apply the appropriate member responsibility based on the services that are rendered. So whether that's a copay, their deductible amount, or coinsurance, they then receive an email or a notification alerting them that they have a bill that's ready to be paid. So they can log into the app and review and pay that payment or decline payment if they'd prefer to for any reason. And then a member can take advantage of EasyPay on a claim-by-claim basis or by saving a card to their account for more automatic payments, which we'll talk about in just a moment. But again, in the upper right-hand corner, there's filters where they can show a broader date range or more specific details like bill type, the status, what's been paid, or what they might have pending as far as a bill from their doctor's office. And they can sort by patient as well. So once these filters are applied, if you go back, there's a Get Report button that can produce a PDF or CSV file to be emailed to the plan member for reference, or they can click into each one individually. And then back to the My Plan page is there summaries of the plan election. So in the demo, we have data loaded for dental and medical coverage. And this is another page that we're going to continue to enhance and improve upon as we continue to work on the app. But currently there's high-level details as far as the deductible and out-of-pocket and preventive care, because that's a big question that we get. And the C coverage details links to the custom benefits website that we produce for each client, where members can review more details as far as what the coverage is for their doctor's visits, whether it's a copay, etc. So more of that is planned to be moved into the app interface versus the link, but this was the solution at the moment. And then next, like Josh mentioned, a feature we really wanted to make sure was integrated was finding care, as that's one of the big questions we get in our call center is, where do I go to the doctor? How can I use my benefits? So with all of our different network partners, this was one of the challenges that we wanted to make sure was not we wanted it to make sure it was very integrated and simple and easy to use. So this Find Care button links them right to their Find a Provider or Find a Doctor page for the appropriate network that the member has. And it opens up in an embedded browser, so they're never leaving the app to find this information. And again, this was a part that we really wanted to make sure we got right, and we hope that members find it to be beneficial. And when they have those questions, they can go right to the app to see, here's the doctors that are close to me that are in my network and covered. And then the next section that we'll review is the account page. Again, just reiterating, this page has the contact us bubble integrated, and also links to the ID card page, because we know those are the big questions, is how can I get in touch with you, or where's a copy of my card? The My Profile section reviews all of the demographic information, so they can see their address that's in our system, etc. The statement and explanation of benefits gives really quick access to the monthly statement that we produce. And again, this is something that's a bit more unique to HealthEZ, is instead of an explanation of benefits that goes out each time a claim is processed, we produce a monthly statement that summarizes all pharmacy and medical activity, and it's in an easy to read format that mimics a credit card statement. So something that people are familiar with reading and should understand what they're looking at when they're seeing, I went to Dr. Smith and I should have a $100 bill that I owed or I already paid through Easy Pay if they chose to do that. The detailed explanation of benefits just gives further breakdown if someone were to want more detail, but the statement answers all of those questions. And again, it's something that a member would receive a notification on and an email to say it's been posted. You can go review this in your app or your online account. The covered members section will show all dependents enrolled and their birthdays, so that a member can go in to see, yep, everything looks accurate, and includes Lola, as Josh mentioned earlier, so which show all family members on the plan. And then the notifications and paper preferences just allows the member to set their choices for those pieces. Next, we'll look at the Easy Pay or managing the Easy Pay account. As I mentioned earlier, if a member chooses to save a card to their profile for Easy Pay, this section makes it really easy to add multiple payment methods and choose the priority. So in this example, Josh, or the dummy data, has the American Express card loaded as the primary card. So each time a medical bill has been processed and the patient responsibility has been applied, that card would be used to pay that portion automatically, unless the member were to go in and decline payment. So it can be used as a total. Again, a notification is sent each time it's been processed. But if it's your choice to more have an auto pay experience where you don't need to look at each bill that's been processed, everything will go through the system, and you should avoid receiving any medical bills from your doctor, which makes this really convenient. And through the other pages and integration in the app, you can see everything that's been paid. Adding additional cards is as simple as typing in more information, or the card number and the expiration date. And then if you're wanting to change the priority, it's just a drag and drop feature on the Manage Card page. And then next.
And I just have to say, I have to tell this story because Easy Pay is truly a really efficient way to pay claims. So I always tell this story. When Lola was born, we obviously had bills for Lola. We had bills for my wife, and we had a bill for the hospital. We had a bill for the anesthesiologist. We had a bill for the pediatrician. We had a bill from a lab company. We had a bill from the hospital lab. And if anybody's ever had to pay any medical bills, that basically means that you have to go set up online accounts at 5, 6, 7 different organizations and then go pay them directly. With Easy Pay, I didn't have to do any of that. I literally I had my American Express card on file. Claim would come in. I tend to, want to look at it before it auto pays. It will auto pay, but I like to look at it. And all of our claims were paid right through here. I didn't have to go set up, an account, through the hospital or through another organization. And that's to me, that's the value prop as a consumer. Is it's bill pay. It's one location where you can pay all of your medical bills, and then you even get the added benefit if you look on the insurance card where it says no payment due at time of service. So this tells the provider that when I come into the office, I don't need to pay a copay. I don't need to pay a portion of my deductible. I don't need to pay a portion of my out-of-pocket. No payments due at time of service. And as soon as I get the medical claim and I have a chance to review it, it'll be debited against my credit card, and then the provider is going to get paid in full. Easy as that. Tap, pay, done. So it really is a huge benefit for people who are busy, and frankly anyone who just doesn't want to deal with the complicated way of paying hospitals and providers directly. So that's my 60-second spiel on why Easy Pay is fantastic from a consumer, personally, from my experience.
Yeah, absolutely. The last section that we'll just walk through is if for our members who have flexible spending accounts available through HealthEZ, we've also integrated that into the app where they can click in to see their annual election along with the available balance and the deposits as they are made through payroll, so they can quickly assess, here's what I have and here's what I could request for reimbursement at that time. And right through the app, we've made it simple to send in that reimbursement request. They would put in the date range, the name of the dependent for dependent care as an example, and then the amount that they'd like to be reimbursed. They can attach photos or files right from their phone for receipts or proof of payment so that we can process that reimbursement. In addition to sending us their direct deposit elections. So again, our focus was to make it as simple as possible to say, here's one place to do all of your transactions, including FSA or medical transactions for paying the bills through Easy Pay.
And then most importantly, we have our terms and condition and privacy information. So if individuals do not want to have their information tracked, they're able to opt out, and they can read the terms and conditions of using the app, which I'm sure everybody will read when they access the app.
Yeah. And so I alluded to some of the enhancements that are in the works, but Josh, if you want to touch on some other things that are coming.
Sure. And I think somebody's trying to call. So the app, as it was designed, we wanted to make sure that we had the ability to see high-level benefit information.
Hey, Josh, looks like you're on mute, but I meant to only call Dina. I accidentally hit call on a...
Sorry about that. Technology. So the app, we wanted to make sure that we had information available that answered the questions, which Brianne did a great job of walking us through. But there's obviously other items that we want to make sure are included in the app going forward. And some of the information is both a benefit add, obviously, to the consumer and hopefully to the health plan. And so there's actually, one of the things that we've been spending a lot of time on in the last couple of months is the No Surprise Billing Act. And so as part of that, there is some new requirements of insurance companies that will be coming out effective January 1st, 2022, that will need to be complied with. And one of those is a pricing tool. So we actually are in the process of developing and designing an integration into the app that will be part of the Find Provider search function that will allow consumers to shop services essentially. So this will allow a member to go in if I need to go see a primary care physician or I need to go see a specialist and I go to search for a specialist. It's going to give me a list of providers, and it's also going to give me a cost estimate if that's what I want to see. And so one of the things that we're working with is obviously here in Minnesota, we own our own PPO network. And so we have all of the provider contracts, we have all of the fee schedules, and then we have a API connection with CMS that allows us to pull in that publicly made available data on quality and cost. So there'll be more information to come on that cost estimator tool, but we're really excited. Outside of the No Surprise Billing Act, we think it's going to be a great value add to our consumers and to the health plans, and it will hopefully allow consumers to make better decisions on services and see costs for those services. Brianne also alluded to adding detailed plan benefits in the app. So when we pulled up within the mobile application, you could go to the custom benefit website and it would have a greater breakout of all of the benefits. So what we've laid the foundation for now is that we will be able to include more high-level benefit information within the app without having to go to an embedded web browser. And it's also allowing us to expand our IVR capability. So we launched an interactive voice recognition system in May that was completely geared toward providers. Our call center, generally, the rule of thumb is about 75% of our calls are going to be B2B and with providers answering benefit questions, claim questions, eligibility questions, etc. And so when we launched that IVR, the two main pieces of functionality that are now available to all providers 24/7, 365 by calling the provider phone number on the back of every HealthEZ member insurance card is eligibility and claim status. Well, now that we have laid the foundation for pulling in the benefit information into the mobile app, we're now going to be able to expand the IVR system to allow providers to enter in a date of service, a CPT code, and their tax ID number, and it's going to read back to them what their benefits are. Our customer service, we feel, is fantastic. It's the backbone of everything we do here at HealthEZ, and they're open from 7 a.m. to 7 p.m. Central Time. But we understand there are times where after hours eligibility and benefit information is needed, whether it's at an urgent care or an emergency room or an ambulance provider. And so providers already have the ability to check some of this information online through our provider portal. They now have an additional ability to check eligibility and claim status 24/7, 365. So if you go to the urgent care at 6 a.m. Eastern in Atlanta, Georgia, your provider has no excuses to not get updated eligibility status. They just need to call the provider phone number that's listed on the back of your insurance card, follow the prompts, and they'll get a readout of what your eligibility date is and that you're active. So we're really excited to launch and to include more detailed benefit information. Also excited, we're hopeful in the next 30 to 45 days that we'll be able to integrate the insurance card directly into your Google or Apple Pay wallet. When we launched this, that was obviously a priority. We have a digital insurance card that has an updated effective date listed on it, but we want people to be able to just put it in their wallet, just like their Delta Airlines ticket, so that it's always at hand and they can show it to providers. We have a clinic advisory committee, and it's interesting. I posed the question to them, and it's 15 hospital and clinic administrators here in the greater Twin Cities, and I said, could we do away with physical insurance cards? And we're not going to, just to be clear, because I'm sure everybody on this call would have a heart attack about that. But the providers were pretty clear that they are not ready to do that and that they still want to see physical hard copies of insurance cards. And as Nazi always says, that insurance card is unlimited liability. It has the greatest liability of any card that you have in your wallet. So the fact that providers struggle to accept a digital copy of an insurance card that tells you when it was downloaded, that it's still active, or it gets updated to be terminated if the coverage terminates, we're going to have to work with our provider community to get them into the 21st century. And then we're also excited as part of the Easy Pay service to integrate Apple Pay. So Apple Pay, for me, is something that really makes things extra easy. Easy Pay is already easy, so I don't need it. The card's already there. It basically works like Apple Pay. But if somebody doesn't want to store their credit card on file, they don't have to. So there is an option within the app to click on a bill, to hit Pay Now, and make a one-time payment if you don't want to include your credit card. And so we plan to do a full integration with Apple Pay so that somebody can, just hold the phone up to their face and pay their claim using Apple Pay. And then lastly, we, as part of that cost estimator tool, we already have the design done for an enhanced provider search that basically would be a universal layout and look and feel across all providers, and we hope to also be able to integrate connections to some of our great telehealth partners, so that when somebody goes into the app to find a provider, it will give them an option to select a hospital, a provider, a facility, or telehealth. And so if they have a telehealth solution through HealthEZ's Teledoc, and they select that, it should link them to pull up directly the telehealth app for the employer. So we're really excited. The team's focused on continuing to enhance the member experience. And this is, we wanted to make clear that this is just the beginning, and this is not the end state of the app, and it's going to be a continual enhancement. One of the other things, I can't guarantee that we'll be able to do them all or do them all at once, but one of my favorite things is getting feedback from users on what do you like, what don't you like. Is there some functionality that you think would be really cool to integrate into the app? We think we have a lot of great ideas, but we know that our members and employers also have great ideas. And if there's a way for us to add that as a new enhancement to the mobile app, we are 100% on board with that feedback and would certainly welcome it. I want to say thank you. We'll get into questions here in a second, but I just want to say thank you to our external beta testers. So we went through about a month of internal and external testing of the app. We had employers, we had HR representatives, we had internal staff members testing the app and providing us with fantastic feedback on what worked, what didn't work well, and that was really, really critical to the successful launch of the app last week. We have really not had many complaints. We've had a lot of great feedback that's been submitted either through the App Store or directly to our client services team or account management teams, and we're really grateful for everybody's support. So with that, I am gonna turn it over or back to our host.
Thank you, Josh and Brianne. That was fabulous. We have quite a few questions here, so we'll get to those right away. And the first one is, how will this app be communicated to our members?
It's a fantastic question. So we launched an announcement email campaign that began last week. There'll be a continued focus on member education from an email marketing standpoint. We also sent out information to brokers, employers, to also let them know and to ask them to tell their members and their employees about the app. And then we are working through updating all of our member-facing mailers, so any of our direct mail information. The number one way that members receive mail from us is when they get a copy of their insurance card, when they become new to the plan or have a change to the plan. So there will be information included on ID card mailers going forward that'll remind employees to download the mobile app. And then lastly, if you go to your custom benefit website, any of your employer custom benefit websites, there should be a very big bar across the top that gives you a link that will take you directly to a landing page about the mobile app, and will also allow you to click a link that'll take you straight to your app store, depending on whether you have an iPhone or an Android user. And then Brianne can, if you've got any other areas, I'm sure there's other ways we'll be communicating this.
Yeah, the only other way I was going to mention is specifically as we enter the open enrollment season. I think that'll be a really good time to remind employees again, here's where you can go to get information, and continue to use this in the new benefit year as we approach that. So lots of opportunities to come in addition to what's available today.
Yes. Yes,
Great.
and if you're on this webinar and you haven't told your employees yet, please tell your employees. We want them to use the app. We think it's a great value add.
Okay, and is the app offered at no charge to members?
Of course. This is a benefit of doing business with HealthEZ. You get a state-of-the-art mobile application that's obviously included as part of your administration and other fees.
Thank you. Next question regarding Easy Pay. So how do you handle Easy Pay with providers who require upfront payment, especially if you're going in for surgery or other procedures?
You want to answer that one, Brianne?
Yeah, absolutely. So that's one feature that certainly comes in handy is, like Josh mentioned, as soon as you add a card to your account, a new card, or save a card to your profile, I should say, a new ID card is printed that shows that no payment due at time of service. So ideally, the provider would read that and agree that, I'm not going to collect any deductible estimates, etc. But in addition to that, gives us the leverage or the power to call the provider and say, here's the situation. The member has a payment method. You'll receive payment in full from the plan once it's adjudicated in our system, and we apply the appropriate member responsibility. We really hate those situations where they're asked to collect at the time of service, because it's totally based on an estimate, and it's ultimately it turns out to be incorrect many times. So those two pieces or components that help to leverage that power to say you really shouldn't do that certainly help.
Yeah. One thing I am excited about, and we'll see how much adoption there actually is as part of that new No Surprise Billing Act, there's a requirement for an advanced EOB. And that, for members who don't want to use Easy Pay and don't have the benefit of having the disclaimer on their insurance card, there will be mechanisms in place where a provider, at the request of a member, can essentially submit a claim for a predetermination, and that predetermination has to be a good faith effort to price and appropriately apply what the member's benefits essentially would be on that claim. So we're obviously working to design that advanced EOB with that information, but that may be something that will help consumers, because as Brianne mentioned, providers estimate prices, and they may work with 50 or 100 commercial insurance companies. They don't know what, especially the person at the front desk who's collecting whatever payment at time of service, they have no idea what the allowable is going to be. Our belief is members should not pay in advance. Obviously, we understand that's not always possible, but should try to do everything to not pay in advance, because you want to make sure those network discounts are counted before you're making a payment.
Great. Next question, will there be info about the app available in Spanish?
It's a great question. I am sure.
All right. Sounds like that might be future development.
Yes.
Great. And do we have any flyers or printed information that employers can distribute to their employees?
Yes. So if you did not receive one of the probably half dozen emails that were sent out, our account management team is happy to provide you with a PDF flyer of the mobile app, as well as with a link to the landing page at HealthEZ.com that talks about the mobile app and gives you a link to download the mobile app directly to your smart device. But yes, we do have marketing material. If you do not have it, please reach out to either your sales representative or your account manager, and they'll be happy to get you a copy of that.
Great. I think that's it for the questions. We have one comment from one of our trusted advisors who said that after he's looked at all the major carrier apps, this appears to be the most functional, best designed app that he has seen. So congratulations to everyone who was on this team to develop the app. And with that, we will conclude this webinar. Thank you so much to Brianne and Josh for presenting today. I think it's great with the questions that everybody wants to communicate how to get on this app. So that is great to hear. And we want to thank again our sponsors, Accurus Solutions and Nationwide Insurance. And I hope you'll join us for our next webinar, which will be on August 12th at 11 a.m. Central Time. And that one will feature our underwriting department and our chief risk officer. And so this is, again, is something that separates HealthEZ from many TPAs, where we have the power of the pen, as we like to say. So we hope that you'll join us then. Look for your invitation on that. Thanks again. We had a full house today. We hope you enjoyed the presentation. Have a great rest of your day. Thanks.
Thank you.
Thank you.
And ladies and gentlemen, thank you. We would like to thank everyone for joining us. On behalf of the presenters and HealthEZ, thank you for joining and have a great day.